Explaining to patients how their thoughts and fears and anxieties can influence their pain can be quite challenging, because if it's not done right, the patient can walk away thinking that you've just told them that all their pain is in their head and it's just their thoughts that are causing their pain. However, if this is done properly and the patient truly understands the influence that their thoughts and emotions have on their pain perceptions and how they cope with pain, they're more likely to feel optimistic about their recovery. They're more likely to change their thinking habits, and which results in faster recovery. I'd like to demonstrate with you in this short video how I educate my patients on how their thoughts can influence their pain perception and how their body responds to pain. I'd like to demonstrate to you how our thoughts and fears can influence how we feel. So is it okay if I just touch your hand for a second?
Yes.
Bring your hand here for a second. I'm just going to stroke it gently like this. What are you thinking right now? Your brain is probably thinking, oh, this guy is touching my hand. Hopefully it's not threatening to you because you trust me, we're in a medical environment, and you already know that I'm trying to explain some things to you. Your brain is saying, why is he stroking my hand? I hope it's okay. Well, you don't really care much about for it. Now, the reason that happened is because you didn't find that very threatening. Now, what if I was a stranger on the bus and did that exact same thing right now to your hand? What would happen? It's a complete different reaction now. Your heart rate would go up. Your respiration would go up. You'd breathe heavily. Your blood pressure would go up. You'd probably start to sweat. You'd feel angry. You'd feel anxiety. And you'd wonder, what is happening to me right now? And instantly your muscles would get tense and you'd either have the fight or flight response, which is either to fight me or run away from me if I was a stranger on the bus. Now the sensation is exactly the same. The first part that I did it to the second part. But what was different this time was your belief. So when we feel pain, our beliefs make all the difference in how our body reacts. So if your belief is that this pain is dangerous, it's caused by my arthritis or disc bulge, or I'll never get better, then the brain responds with muscle tension, anxiety, which actually increases the nervous system hypersensitivity. On the other hand, if your brain responds that it's okay, this is temporary, and it's not that threatening, you're less likely to have negative reactions to the pain, and recovery will be faster. Does that make sense?
Yes.